Childhood obesity is a rising concern these days in not only in our country but globally. It has been recognized that in the last 30 years the incidence of childhood obesity in our country was just 1% and it is increasing progressively at a rate of 0.5% per year, and now it has reached to the level of approximately 10 to 15% of our adolescent population is obese. So let's talk about today about healthy heart of the kids. Hello, I am Dr. Murtaza Kamal, consultant pediatric cardiology in Rainbow Children Heart Hospitals, Hyderabad. Today I will be discussing about the healthy heart habits of our children. So how do we maintain healthy heart habits? And the thing which is important in this concern, that keeping a healthy heart is not a restriction which we are putting for our kids, but it is to empower them. We are empowering them by making them follow these healthy heart habits. So how to go about it? The first and foremost important thing always comes the physical activity. Doing physical activity for kids? Yes. Now, what the kids do in the initial ages of their life, they will carry it to their adulthood. So the form of physical activity which these kids can do is in the form of play. Let them jump, let them roll about, let them play in the parks. Don't restrict their activities, because even they need at least 60 minutes of moderate to vigorous physical activity per week. Play with them, be active with them. So adults should play as a role model for their kids in the physical activities. Involve them in different games, activities, in school, outside school. Let them participate in different physical activities and let them be a part of it. The second most important part in this is the role of diet. The early healthy diet starts from our table. Make the plate of these kids a rainbow. By rainbow I mean to say that it should be colorful. They should have ample amounts of vegetables, fruits. It should have all the colors in it. Give them fat-free diet, mostly those which contain less of fat. Give them nuts. Give them lean meats. These are the things which will inculcate healthy eating diets. Ultra processed foods, added sugars are nevertheless always not good for them, and they should not inculcate this habit of eating these. So this we can develop by giving them ourselves as role model. The third most important part is the screen time. Nowadays, lots of kids are with screen. They are on mobiles, iPads, televisions. So the Indian Academy of Pediatrics has given a recommendation to limit their screen time based on their ages, and on an average not more than 2 hours a day is recommended for them. Along with the healthy lifestyle comes the healthy sleep. The sleep should be sound, so we should have a sleep hygiene for them. They should be sleeping in dark, calm environments. We should be around them, and we should make them feel comfortable so that they can sleep comfortably. So basically, to put the things in a bag is that developing healthy hearts for our kids starts from the early childhood, rather than, because this early childhood is what is going to go in the adulthood. They will act as they have learned in the initial days of the life. So we have to take their physical activities checked regularly with our pediatricians and pediatric cardiologists. Also, some high risk groups are there, so there even blood profiles of lipids, cholesterol should be checked. Blood pressure for every child who comes to our outpatient should be at least checked at least around 3 years of age once. So these things are going to help us in maintain a healthy lifestyle for our kids, and we can give our kids a better future for their healthy lives. So to put the things in a nutshell, I will again like to emphasize that developing healthy hearts for our kids is not a restriction, it's an empowerment. We are empowering our kids to develop the healthy lifestyles so that they can have a healthy habit and they can have a future in which we have healthy hearts for our kids.